Hi, Dave from Informed American here, talking to you with a very special guest, epidemiologist and physician, Dr. Paul Zeitz. Dr. Paul, thank you so much for joining me today.
Hey, Dave, great to be with you.
Now, you're here to discuss all things COVID-19, and you have some expertise on this global pandemic. You currently serve as the founder of Build a Movement 2020, and you're the member of the COVID-19 Emergency Response Group that is mobilizing to save as many lives as possible during this COVID-19 pandemic in the U.S. and globally. So I'd like to hear a little bit about those two things, and then if you could, maybe talk a little bit more about your background and your work experience in dealing with infectious disease and all that stuff.
Great. Thanks, Dave. It's great to be on the program. I'm a physician by training. I got specialty training in public health and preventive medicine and began my career actually working on polio eradication and was working in Latin America on that. I also worked for the CDC as an epidemiologist and worked on a variety of outbreaks, the bubonic plague, meningitis, the hantavirus epidemic. And then I was in Africa in about 25 years ago, working on the HIV/AIDS pandemic and the global pandemics of TB and malaria. So I have done a lot of work in this infectious disease zone. I also got involved in other issues like sustainable development and the climate emergency. So I've had to dust off my infectious disease epidemiology and get on top of this COVID crisis that we're in.
Yeah, absolutely. And I very much appreciate this work you're doing. I mean, this does seem like, well, it is, as they say, it's a new thing. So it seems like everybody, all experts it's a sort of all hands on deck scrambling to figure out a way to get us through this thing. That's the feel from me as just sort of a layperson. Is that the case in the professional community?
Well, I mean, I think it's the first time there's ever been like a global pandemic that is really affecting the whole planet. And at the same time, we have the communication and information technology, so we all have simultaneous awareness. And there's like an information fire hose coming at everyone. And it's hard to navigate the fast-changing nature of what our learning about the virus. And then at the same time, we have this science and medical technology revolution, which is developing new therapeutics and new vaccines. Like every day, there are new developments. So it's a lot coming at all of us, and it's been a really difficult time as we've had to adopt these really challenging social distancing measures and hand washing and facial masks. This is hard stuff. Our life has been disrupted, everyone's. So it's a tough time.
Yeah, absolutely. All right. So we got some questions from some of our readers, and so I want to get through those. But before that, I want to start, let's start this thing from the beginning. First of all, what is COVID-19? What is this thing? So I'd like you to maybe describe what this virus is and maybe what makes it different. So maybe if you could start there, and then I want to talk about how this thing started and how this thing spread. So maybe talk about what the heck is COVID-19, Dr. Zeitz?
Yeah, so there are many different kinds of viruses that circulate on the planet. And there are things that we're familiar with, like the influenza virus.
Okay.
That's a virus. Measles is a virus. Mumps is a virus. So there are viruses that we know about, and then there are what are called emerging infectious diseases.
Okay.
Newly discovered viruses. So Ebola is a virus, and HIV is a virus that we just learned about like in the 90s, and then we had a global pandemic. So what the coronavirus, COVID-19, is in the family of viruses called coronaviruses. It's an RNA virus, meaning that its genetic code is an RNA versus DNA, so it's RNA. And there are other viruses from that group that have affected humans before. There was an outbreak of something called MERS, the Middle Eastern Respiratory Syndrome, and the South Asian Respiratory Syndrome, SARS. Both were new epidemics that affected people, but it didn't go global. They were more localized. So this is a new version of that kind of virus, the coronavirus, and it's called COVID-19. And it's different. It's highly transmissible. Every one person that gets it infects 1, 2, up to 3 or more people. It's also the trickiest thing about it is that there are a lot of asymptomatic carriers. So you could be infected with the virus, you could be spreading the virus, and you appear normal and healthy. Well, that makes this thing a real tricky critter.
Now, is that unusual, this asymptomatic carrier thing? Is that unusual for a virus? That's what I'm getting from you?
The rate of transmission, like how easily it is being transmitted, and the fact that there are so many asymptomatic carriers. Because usually, like with the flu, with the influenza, if you get it, you're sick, and you get medical care for that. So this thing is different in that you can get infected, but you don't know it. And you can be transmitting it to people around you, and they don't know that you're infected. And that's why this kind of rigorous social distancing is being implemented, because you have to assume everyone is potentially infected.
That's what, I mean, in the beginning, I think that we've all come around to that idea, but in the beginning, and at least to speak for myself, it felt like a horror movie in the beginning. I mean, I remember when I went to, this was really before the lockdown happened in my area, just maybe, I guess a month ago, but we knew this was going on. And I remember walking into the store, and it was like I was trying to avoid people, and I felt like everything around me was potentially death, if I got near it or if I touched it. And that's what's been so scary about this thing, is you don't know who's sick and you don't know how to catch it. And then again, I don't even know, as you said, I may not even be sick, but I could be transmitting it to people. So that's crazy. Is there anything close to this? I've heard maybe like malaria or HIV. Some people were saying there's some at least close to those kinds of viruses, or is this truly something completely different?
Yeah, malaria is a parasite, and it's transmitted through infected mosquitoes that bite you as a mosquito. So it's a vector-borne parasitic disease. It's a microbe that makes people sick. So it's similar in that regard, but it has a completely different kind of pathway. Okay. HIV is a virus, which is also an RNA virus, but it's not transmitted the same way. It's transmitted through blood and body fluids, like vaginal fluids or semen. Right. So it's totally transmitted differently.
Interesting. All right. So where are we now, Dr. Zeitz, in this, taking maybe a 30,000 foot view from when this thing broke up, and to what's sort of the state of the world right now with this pandemic?
Yeah, so the first cases we know now were identified in late November in Wuhan, in Hubei province in China. It spread rapidly in Wuhan, and by the end of December, their intensive care units were full of patients. So that meant that it was already transmitted widely in the community, because most people either are asymptomatic carriers, about half of the people that get infected, and another significant chunk, like 30% or so, have mild illness, and it's only the 10 or 20% that get more severe illness, and it's about 10% that require hospitalization. So if they already had a ICU full of very sick people, it meant that there was a lot more people that were already infected. Right. They did a very intensive lockdown and were able to control the epidemic after having some 5,000 deaths. And
the lockdown was extreme.
What happened then was it started spreading globally. Wuhan is a travel hub. So it's a travel hub within China, and it's an international travel hub. And so it went global. So it was probably spreading in the United States since January, I would say.
Interesting.
In California, and now in Europe, we know the Italy explosion happened. It was probably circulating there. And the Italian version of the virus probably came into the East Coast of the US probably as early as January, and it started circulating, and it's exponentially transmitted, as I said, and so then we started seeing it became more visible. And so what happened was it got out of control and went into community transmission. So then we see these huge spikes. Now we have some cities that have spiked and peaked and are now on the way down, and then there are other parts of the country that are just on the upswing. Yeah. So it's like there are different mini epidemics in different parts of the US and globally. So there are some countries that are still on the upswing. There are other countries that are on the downswing. And then what has to happen, now that we know what's going on, we know this invisible virus is out there, we have to implement a containment and control program and keep it contained within a limited number of people getting it. So that's where widespread testing is needed, contact tracing. Anyone that you've been in contact with, if you're positive, they get tested. If they're positive, they get isolated. So you don't, and then, so it's testing, contact tracing, and isolation rigorously implemented, and then you can keep it at a low throttle, and you can also prevent very vulnerable people from getting exposed. And that is what we need to do, containment, until we get a vaccine. So once we have a vaccine, then we can all get a shot, hopefully, and that it'll be highly effective, and it will then we'll have immunity from that.
If we could go back a second, you mentioned Wuhan. There's some debate. Now, we don't need to get into the blame game necessarily here, but just about the origin. Did it come out of a wet market? Did it leak out of a lab, kind of a thing, because of lax security protocols or whatever? Do you have an opinion either way on that?
I am really curious about the origins of this virus. Mm-hmm. I think we don't know what we don't know. Yeah. And I think that it's being investigated. I'm not sure we'll ever really know the truth right now because this has gotten so politicized. Yeah. I think from a public health perspective, it would be really good to understand the original source. I've read some studies showing that it might have started in another part of China and been imported to Wuhan. I know that there are investigations about this lab that exists in Wuhan and whether they were experimenting with coronaviruses and maybe something leaked over to humans. Both are possible. I have no way of knowing. I think we, as people and as citizens, I think we want to create a culture where there's open and trust so that we can get at the bottom of these things, or else we're leaving ourselves susceptible for the risk happening again.
Yeah, I agree 100%. Now, I'd like to, again, ask you as a layman, I've heard that whether or not this particular COVID-19 leaked out of a lab, but from what I understand, in virology labs like the one in Wuhan, they may go out and collect a sample of a virus from, let's say, a live bat, and then in order to study it and to work on basically to learn how it works and to potentially make a drug to kill it, essentially, right? Is that roughly correct?
Well, yeah, I mean, they're experimenting with what is called passage of the virus. So they try to see how it would be passed from bat to different species and then potentially to humans. And, it's not like we don't know that there are bioterrorism risks either, right? I mean, aside from this coronavirus, there are other bioterrorism risks. The anthrax scare that we had after 9/11, right? The smallpox stores, which are held by the U.S. and Russia, which could be released. It's not a new concept that there's a risk of bioterrorism. That is why the White House and the National Security Council and the U.S. government has a very significant intelligence and capability to respond to those kind of threats.
And okay, so I guess what that all makes complete sense. So is this, I guess I'm asking, is this smart? Should we be messing with stuff? I guess now we certainly with a virus that we can identify that we know is infecting people, we can understand that versus something that's maybe doing some kind of engineering, if that's the proper word. And not to use a movie reference, but like say Jurassic Park, you're kind of screwing with nature, and nature might screw back with you. Does that make sense, or is that something different?
No, I mean, I think you're raising an important point. I mean, I think that now, as I said earlier, we're in the middle of this scientific and technological revolution. So just like cloning is a technology that can be implemented almost anywhere, there are labs that exist everywhere in the world where this manipulation of wild species could happen. The other thing that's happening, though, I mean, the most likely source of this is that the human population now is over 7 billion, close to 8 billion people on the planet. So many humans are living on the planet. We're encroaching upon wild habitats, and we're poaching animals from wild habitats. and then we're interfacing them with human populations. That's what's different right now. I mean, Ebola was circulating in bats in Central Africa and the Congo probably for a long, long time. But because there's so many humans there that are now interfacing with the bats or getting exposed to them, that's how Ebola jumped from bat to human. So it's also, now that that's the way it is, we have to learn and study and be prepared for what might happen. Look, this is I've been studying emerging infectious diseases for the last 25 years. Mm-hmm. This was predicted. This was known that this was a risk. And what experts are saying now is that this virus is bad and disruptive, but there could be viruses that are even more transmissible or more deadly. So I would consider this a wake-up call to help us prepare to develop a global capability to identify, prevent, mitigate more effectively than we're doing right now.
Yeah, I think that's a great point. Now, I looked up before we started. The United States.
You're being very agreeable today, Dave.
Well, I can fight back if you want. I'll find something we could disagree on. We'll wait.
I love this. Yeah, I mean, I'm happy to be agreed with. Yeah.
Now, there are about just over 1 million infections in the United States, and I believe 3.2 million globally. Now, those are, of course, the official numbers. What do you think? What's your estimate on infections in the United States? Because the general consensus here is that the number of people infected are, in fact, much higher, particularly as you mentioned, asymptomatic cases and people who just haven't been tested or haven't been to the doctor or anything like that. Where do you put these numbers, ballpark figure?
Yeah, so we have the U.S. has done about 6 million tests so far. So that's about 2% of the population.
Yeah.
So we actually don't really know the widespread impact of the pandemic here. What most people are saying that if you have 1 million cases identified, it's probably at least 10 times that.
Oh, wow.
So there's probably 10 million or more people that have been infected already. So that's, again, now we have about 330 million people in the country.
Yeah.
So there are places where we know there's higher rates of infection. Like New York City did a sampling of their population, and 20%, 1 out of 5 in New York City looks like they have antibodies. But in Santa Clara County, California, it's much lower. It was 3 or 5%. So we're still studying this right now. And when you have an explosive epidemic like New York City and North Jersey is having and is on the recovery from, then you would expect a larger proportion of that population to be infected. But even with 20% infected, there's still 80% that are not infected. So, you could have this happen 4 more times, basically, if we don't do the public health measures that we've been talking about.
You mentioned antibodies, and that brings us to a question that we got from Jim. He asks, how soon will the antibody test be commercially available? First of all, what is the antibody test, and how does that work? Why do we need it? And how far off are we from getting that?
Great. Well, there's 2 kinds of tests. One is a test for the virus itself, which is now done through a nasopharyngeal swab, or there are now saliva tests that are available.
That looks really painful, by the way.
Yeah.
I saw an image of that.
I have not had that, so I'm not looking forward to it, but if I had to do it, I would.
Yeah.
So that's to know if you're acutely infected with the virus, and that's an important test. The second test is an antibody test, which shows that you had the virus, you've been infected, and your body has developed an immune response to it to fight it, and your body generates what are called antibodies, which fight the virus, the foreign body that is invading the body. So having an antibody test available is really helpful because then you know how the disease is progressing in people. You know whether or not we have to study this, but it's hopeful that if you have been infected and you have antibodies, that these might be protective antibodies. I think experts believe that it will be protective. We just don't know how long. It could be for 1 month, 6 months, or 6 years. That has to be studied. There are actually antibody tests that are commercially available now. The labs are doing them. Cities are now doing random samples of their population. There's some towns that are testing their whole town. So the thing that's a little tricky right now about the antibody tests is that the FDA did a rapid approval of them. and didn't actually ensure that the ones that are out there on the market are actually high quality and accurate.
That's not good.
I mean, it was sort of like, it's,
well, we need tests. We got to get the tests out.
If you don't, like, there was such an urgency to get these technologies out there, so they loosened their restrictions. Now there's like a question about the validity and accuracy of these tests. So it'll be a bit of a yo-yo, and then we're going to find that this test or that test or this set of tests are the best, and that's what will get scaled rapidly. And it's also a matter of cost. How do you do it cost effectively so that you can scale antibody testing? Yeah.
So we're just scrambling here and trying to get things out, and it's just going to have to see what works and what doesn't. Because I guess maybe they figure, even if we put this stuff out and it doesn't completely work, at least we're just doing like a live trial on the population in a sense. Is that kind of the thought?
Yeah, I mean, it's like, again, they were in a hard position. They were damned if they didn't do anything, and this is a little bit of a challenge right now. What's concerned me is that there are some commercial outfits that are selling antibody tests for like $700 or $800 a pop, and people are paying ridiculous amounts of money, and it might not even be an accurate test. So I have like a little bit of a yellow or red flag of caution about running and getting an antibody test from anyone that's offering it.
Gotcha.
Just because I don't think it's worth wasting the money rather. The thing that I want to just say, though, to give you like a 30,000 foot kind of perspective, is that we have to recognize that we're living in 2020. The rate of learning and sharing and knowledge that's being generated. This virus just got identified 6 months ago or 4 months ago, depending on when you start the clock. Already there are hundreds of clinical trials for medicines and therapeutics. Already there are antibody and antigen tests that are out there being used around the world, not just here, but globally. Already there are vaccine trials going on in humans and plans for bringing those to large-scale production. I mean, honestly, this has never happened at this clip before ever in human history. So we have to also salute the ingenuity of humanity. I mean, and look at where we're at. Yes, we have 3 million infections. Yes, 230,000 have died. Yes, the U.S. seems to be the epicenter right now with over 60,000 deaths. Mm-hmm. That's absurd. We can do better. We should be doing better. I think that we should not accept that level of death in this great country. And 100 years ago with the influenza pandemic, there were almost 700,000 Americans that died and 50 to 75 million people that died around the world. So humanity is getting more capability. Thank goodness, because we are going to have more and more threats that we have to manage.
Yeah. No, I appreciate that perspective. Thank you. All right, let's move on to another question here. This one deals with transmission. This one comes from Dave. I did not write this one. It says, with the sudden increase in meatpacking plant employees testing positive, which is something I actually did a video on this. We got news from the Tyson CEO saying, look, there could be food shortages. There was that one plant, I believe, that Smithfield owned that I think something like 700 plus people working at that plant tested positive, and maybe a dozen died. So just awful. Anyway, he continues here. Can the COVID-19 virus be transferred from meat packing employees that are pre-symptomatic to the consumer within the packaged meat that we purchase, prepare, and eat? Has the CDC or any other entity tested this specifically? So in other words, can these workers put this on the food that we eat and then we become infected? Is that a concern?
Well, that's a good question. I mean, I think that what's happening is that we believe that the transmission is happening predominantly human to human.
Yeah.
So it's like respiratory droplets or sneezing droplets that is the most likely source of transmission. There has been research that has shown that the virus can live on surfaces like plastic and cardboard and things like that. And that is why this rigorous hand washing is recommended. There's no evidence that I know of or that I've heard about that there's any way that it could be transmitted through the packing of meat and then in ingestion. Okay. The virus is not that stable. It would not survive being chilled or cooled, and it would not survive being cooked if you're cooking the meat. So I think the risk of getting transmission through the actual consumption of a product like that is probably very low or nil. The risk more is that what happens is these workers are working in close proximity to each other. They are in the locker room together. They're in the cafeteria together.
Yeah.
They're on the buses together. and then they're infecting each other, and then they're going into their community, and they're infecting their families and their neighbors, and it's leading to explosive community transmission. So that is what I want to advocate for, is that we implement rigorous containment so we prevent community transmission. We could do that more effectively than we are right now, and that would help us localize this and keep it focal rather than let it spread.
Yeah, that makes total sense. Now, I want to just to go back. I think I appreciate that answer, because I think you may be going to allay a lot of fears here. And one of the things I mentioned earlier was about, I mean, I fell into this trap myself because I read the things about, the virus living on cardboard for 2 days or some absurd number. And you really start, everything I was at the point where I was Lysoling everything that came in my house. I wouldn't touch anything without a pair of gloves. I was really driving myself nuts. I was like, I don't know. I was going to crack with because you just assume it's everywhere. It's going to be crawling on me and I'm going to get it. I'm going to die. But you're saying the surface stuff is a lot less likely than actual human to human coughing, sneezing, touching, that sort of thing.
Yeah, so the recommendations are social distancing, the 6 feet. That's probably the most important thing that people can do, right? Because that way you're not able to inhale or get a respiratory droplet or a sneeze droplet that you get into your nose or mouth. The second thing is the rigorous hand washing, because if someone just sneezed and you touch a surface, then it's possible it could be transmitted. Mm-hmm. So the rigorous hand washing and doing the 20-second ABC kind of thing.
Yeah.
And then the wearing of facial masks, another very kind of awkward thing to do. I'm finding it very awkward.
Yeah.
But what I've observed for myself is, like, when I'm wearing a mask, I'm more likely to do social distancing, and other people are more likely to stay away from me.
Yeah.
So there's a psychological benefit for the masks, and there's a potential benefit of reducing if you're an asymptomatic carrier, you're reducing your ability to transmit it, and potentially you're able to reduce your risk of inhaling something from someone else. If someone walked by and sneezed on you, I think that if people want to wash every package that comes in or wash your groceries, you can't, there's no harm in being overly cautious, but if it's a balancing act, we're trying to reduce risk. And, we can't actually eliminate all risk. There's still risk out there. So I think it's a balance between mitigating risk and maintaining mental health and well-being. And so, I can tell you that I know people in my family or my friends that are doing the kind of things that you were describing. And I'm just my wife and I are both doctors. We're not doing that. We're doing social distancing rigorously. We're doing hand washing rigorously, and we're wearing a facial mask rigorously. And then we know maybe there's a risk. I don't know.
Yeah, I really do appreciate that. That makes me feel a lot better, because it's I'm either going to get the coronavirus or I'm going to have a nervous breakdown. So that's not good either.
Yeah, don't underestimate the level of stress that people are undertaking right now. Yeah. Many people are isolated and alone. I live with my wife and my dog. I know a lot of elderly people are alone and isolated. People in nursing homes or assisted living facilities are not allowed to leave the room. They're bringing food to the rooms, and this is a very, very tough time for a lot of people. People are, 30 million Americans have lost their jobs. They're feeling economic vulnerability.
Certainly.
There's a lot of stress in our community right now. So for your audience to take this as an opportunity for service and sacrifice, and helping others and reaching out and being there for people in need, because we have I feel privileged. I'm healthy and I have the ability to help others. So if you have that, then please consider that.
Certainly. Now, you mentioned masks, and that was actually going to be my next question. This one is essentially about KN95 masks that we saw in South Korea. And I believe the distinction between an N95 and a KN95 is that the KN95 is a Chinese standard, essentially. And this person was asking, look, I come into contact. There's a guy, she says, I know that the N95 masks are reserved for first responders, but she also goes to work in a courthouse and also in lockup dealing with prisoners. So I would assume, based on your prior answer, that you would recommend anyone to wear a mask, that as long as it's not going to otherwise take from a first responder. Is that correct?
Is that Dave again asking that, or that's? I don't know how many Daves there are in your network.
No, this one came from Rosemary, not
Oh,
David.
hey, okay, Rosemary, yeah. So, I mean, at the beginning of the pandemic, there was a great shortage of medical surgical masks and N95 masks. So,
Yeah.
that, making those as a priority when the epidemic was peaking and we thought health workers were going to be overrun and there were actual real shortages of this equipment, then it was like deploy those things for people in the front line as a first priority.
Right.
That's probably still true. For Rosemary, if she's actually interfacing with prison population, they are at very high risk. We're seeing a very explosive pandemic and many epidemics in prisons all over the country. Because again, prisoners are in close quarters, they're interacting. It spreads wildly in prisons, unfortunately. Their health care is limited, and so there are a lot of very sick prisoners, and prison staff as well are getting sick and also getting affected. So I would recommend for her to wear, the highest standard of mask that she can access. I'm not an expert on the difference between KN95 and US produced 95.
Yeah.
I'd have to refer you to the CDC guidelines on facial masks. They do discuss that, and you could clarify it by reading the CDC guidelines.
Great, but any protection is better than nothing, right? And try to get the highest protection you can get. I would assume.
Oh, I mean, if Rosemary is interfacing with prison populations, I would be on high alert. I would definitely be social distancing 6 feet. I would definitely be wearing a facial mask. I would do rigorous hand washing whenever I was in those environments.
Dr. Zeitz, we got a lot of questions to get through, and I know our time is limited, but just before we move on, I want to, because masks is actually a rabbit hole, but I don't want to go too far down, but I do want to ask you this. Early advice from the government was essentially, don't wear them, they're not going to work. The question to you is, were they telling us a noble lie so that people wouldn't hoard them? Is that what was going on there, or did they really think that they weren't going to be effective? Because the guidelines have very much reversed themselves, particularly from seeing what's going on, the effectiveness in other countries and the like. So do you have a thought on that?
I think that what happened was there was this urgent need to make sure that masks were provided for the frontline workers. And at the same time, there wasn't clear evidence that masks would work. I think what happened was there was data coming in from China, South Korea, and the Asian countries showing that it was effective. And there were studies that kind of made the case for that. And CDC modified their guidelines. So I think, to me, if we're learning and we're creating new guidelines based on data and evidence as we go forward, that's what we want our public health leaders to do.
Yeah.
And then we want to be consistent with our messages. That, as a public health expert, the most important thing is to communicate the consistent thing from all sources so that people don't get confused.
Absolutely. Yeah, 100%. And then the more information, the better. But yeah, I think misinformation is a problem. And even if you're getting it, I mean, I hate to call government misinformation, but in a sense it kind of was. I mean, they're waiting for the right evidence. Whereas, I mean, they could have just said something like, just put on a bandana, better than nothing. I don't know. But all right, let's move on. Got a question here from Lacey saying, I'd like to know your thoughts, Dr. Zeitz, on if and when the second wave will hit and what we can do to prepare. So the second wave is essentially, I think you mentioned this, we go over that big hump of infections, but then it kind of comes back a little bit, maybe as we reopen the economy, or as you mentioned, that 80% of people who haven't yet been infected yet. How dangerous is this second wave, and what can we do about it, Dr. Zeitz?
That's a great question. I mean, it does not look like the coronavirus, COVID-19, has a seasonal variation, which means that it's not going to go away because it gets hot.
Okay.
That was something that we thought might be possible. That's what happens with the influenza virus, where it sort of goes away in the summer months and it comes back in the winter months. So coronavirus is here with us year round. So what's happening now is that in some places, we're transitioning from widespread community transmission, and we're now containing the virus into small, contained, controlled populations. That's what we want to see happening everywhere. Then we're in a dance. We're going to be in a bit of a dance, right? We all want to open up our lives. We want to open up our society. We want to open up and go back to some semblance of life as we knew it. And we're going to have to be closely monitoring how that goes, and whether or not that is going to lead to widespread community transmission. So the idea that I'm a strong believer in is that if we have a rigorous, massive testing capability, so that you're always getting tested, regularly. Like if I was going to go visit my mom, who's 82, I would want to get tested before I went to see her.
Yeah.
So that I knew I was negative, so I wouldn't give any risk of giving it to her. Or if I was a frontline health worker, I want to know that I'm negative before I'm taking care of other patients. Then isolating people that are positive, doing contact tracing and isolating so that we can contain the virus. If we have that system up and running, then we can start gradually opening as well, and we can do that safely and smartly. And we have to be monitoring, is it exploding again? And then we have to contain it. We know that prisons are a hotbed. We know migrant workers. We know factory workers, like you said. We know there are these kind of vulnerable populations where we can do more intensive containment.
Excellent. Where are we on the curve, Dr. Zeitz? This big bell curve of infections and before maybe a second wave. How close are we to? Are we on our way down?
Some parts of the U.S. are like have peaked and are coming down, like New York and North Jersey. Maryland, where I'm at, is sort of like a slow, steady, low level kind of throttle. So it's mostly contained, we hope. There are some epidemics happening in nursing homes and other facilities like that. I think Florida, is a wild card right now. We don't really know. The testing's been very low there. And also the reporting from the state is now compromised because they're hiding information about the number of people dying.
Oh, that's not good.
That is just really disturbing. I think what we need to have is open data and build trust and confidence in what is actually happening. Even here in Maryland, we were fighting the governor to get data about what was happening in nursing homes and so forth. People need to know what's going on so that we can all optimize the response. So I think parts of Florida could still become explosive. I'm very concerned about that. And they're opening it up while they're still on the upswing. So, that seems risky to me, but we'll see how it unfolds.
Yeah, certainly. So let's make this a little bit personal, or just to an imaginary person who's getting symptoms. Now, I've heard that I've looked up the symptoms for this thing, and they've ranged wildly. Anything from a dry cough to not being able to taste or smell to digestive problems. So, for someone that might be feeling like they're getting something, what are the sort of the things of like, I need to see a doctor? Like, I think because people are afraid, to go to a doctor, go talk to their doctor, to go into a hospital because they think it's nothing but sick people, or, they might be endangering themselves or something like that, or be scared of being put on a ventilator or something. What should people best do to protect their own health and try to manage this thing if they do become worried that they've got it?
Yeah, I'm scared about being put on a ventilator for sure. So I can relate to that. So like you said, it's cough, fever, chills, muscle aches. There can be other symptoms like stomach pain or sore throat. Right now what happened because of COVID is that most medical providers are now offering telemedicine. They've completely transformed their practices, and they are available over a video call like this. So, but it's secure and private. So I would say, like, if you're having any kinds of symptoms, consult with your physician or your medical provider and check it out with them. Don't brush it off.
Okay.
And it's nothing and it's just going to go away. Seek medical care and seek a consultation. Now, they might say, well, you need to come in and get tested. And if you go in and get tested, you get tested. You might also be tested for strep throat or for influenza. So sometimes doctors are testing you for all three of those things. And then you're on their record and then they can monitor you. What's really challenging about COVID is that people are getting really sick during the second week of illness. So that group of people that does get sick, they seem to have like a flu-like syndrome, muscle ache, weakness, whatever, all those kind of symptoms that you described. And then they feel like a little better, but then the second week they get very sick, a subset of people. Now, we don't know why certain people go into this kind of second cascade of downward illness. So that's where you have to be really cautious and in touch with your doctor. You want to get medical care quickly if you're getting worse. And so I strongly encourage people to be in direct dialogue with your doctor and be closely monitoring it. Don't just brush it off as saying, "Oh, I'll be fine." You know, we do that as humans. We try to minimize it. We don't
certainly.
We don't want to be sick, but love yourself enough to get medical care and get the kind of support you might need. And do that early rather than late. The earlier you get on top of it, the better off your clinical course will be. And now we have drugs like remdesivir and others that are being studied that could be used to help prevent the illness from getting very severe. So there's a real benefit to getting early recognition, early testing, and early treatment.
Good advice there. Thank you. All right, let's move. You mentioned the economy. Let's kind of move into that. And a question I have for you as an epidemiologist, and because it's something that's become really the crisis, which is the question for you, Dr. Zeitz: do epidemiological, is that the right word? do these models?
Epidemiologists, yeah.
Okay. Do these models account for an economic impact? Now, the ones that I see are mostly about deaths, but how do we now have to take this thing into account as we've seen the real cost of shutting down the economy? When people are talking about transmissions, death rates, how do we now take this economic thing into account?
Yeah, that's an excellent question. I mean, I think that I don't think that most people would have imagined that with this kind of pandemic, that it would have led to this cataclysmic economic impact.
Yeah.
We have like 30 plus million Americans like unemployed, and our economy is tinkering on the verge of a depression. Yeah. And that's having an effect globally, right? There's a global downturn. I think as society, we have to really look at what our values are. Do we value saving as many lives as possible? And do we build an economic system that optimizes our ability to keep people healthy, prevent pandemics, keep them healthy, and also have economic productivity? You know, I think what this is revealing for me is like how fragile we are. Like, look at this is a serious pandemic that required serious public health interventions to save lives. I mean, we're now at 60,000 deaths. We could go up to 100,000 or 200,000. But I think by implementing these public health measures, we prevented it from getting to 2 million or more. So the value of that versus the economic impact is what we have to think about. I'm committed to saving lives. I think every human life is valuable and sacred. Yeah. And I want us to rebuild and recreate our economy to have resilience, and so that there's a way that if we have to do another close down, people don't all lose their jobs and lose their housing, have their utilities shut off, and get put into an economic spiral. I mean, I think as Americans, we can do better. We can create a public health and medical system that people have basic, better resilience, and an economic system also that's more resilient. It's just the inequity of our economic and our political system is being revealed now, and we can fix this and transform it to create a better, more healthier society for all.
Yeah, I've been thinking a lot about this myself because we heard about getting back to normal. And it's like, well, what is normal? I mean, getting back to what it was before where we're this vulnerable. And I remember hearing this thing about it's what's called like the just-in-time economy, referring to our supply chain that, 2 or 3 days and that's it. And it turns out our paychecks also just come in just in time too, and we all live heavily in debt and very susceptible to a simple shock. So yeah, I think we all need to be asking ourselves, is this the way we want to live going forward, or is there another way? I agree 100%.
Yeah, I mean, I'm rejecting the rhetoric about returning to normal. I think we have to create a new forward.
Yeah.
And we have to really use this as a wake-up call and an opportunity for transformation, and for us to also heal our country and heal America. It's so divisive, yet when we're in this kind of crisis, we're all in this together. We're all the same. We're all humans. We all love our family and love our neighbor. And so we have to create a culture of solidarity, and we have to build trust between citizens and between the people and the government again. a lot of this is very scary because America was a beacon of health leadership on the planet. America was a beacon of the ideas of democracy and liberty and justice for all. And I think many of us are questioning where we're at. And also around the world, people are going, what's going on? I mean, the Americans led smallpox eradication. Americans led polio eradication. Americans led the response to the Ebola crisis, our technology, our know-how. And everyone looks at us now and they're going, what is going on over there? And we have to look at that ourselves and go, I believe we can do better. We have the capability, we have the genius, we have the innovation kind of genes.
Yeah.
We can do better than we're doing right now.
Certainly. You mentioned treatments. This brought up a question here that I got from Colette. It says, when are you going to form a strong movement to be able to prescribe the findings of Dr. Didier Raoult? And I believe he is a French physician who was one of the earlier who was touting the efficacy of hydroxychloroquine in combination with Z-Pak and I think a shot of high dose of zinc or something like that, and said it was very effective, at least initially. What do you make? And this is, I mean, we talk about political. That treatment itself has become political. But what do you think of that treatment itself? Is it promising? Does it work for everybody? Is it just or what? I mean, what are your thoughts on that? The findings of Dr. Raoult? Yeah,
I'm a doctor by training, and I'm a public health medical epidemiologist. So I really do believe in data, science, and evidence. And I'm a strong believer, as is Dr. Fauci and Dr. Deborah Birx, in doing case control studies. So what Dr. Didier from France reported was not a case control study. It was a case report of a group of people who he experimented with, and he reported this result. Now that's okay in the kind of crisis that they were in, that he did that. And then the next step is to do an actual clinical trial where you actually test it out. And it turns out that it's not safe and it's not effective, according to the latest research that was done here in the United States. So there are hundreds, literally, I think it's over 300 clinical trials right now underway in the US and around the world studying different medical therapeutics. You want to make sure that what you're taking is safe and effective. You don't want to just be whimsical about it. Yeah. And I think it's been a bit of a theater of the absurd for political leaders to recommend drugs that haven't been proven. I just think that's dangerous, and I think America should demand a higher level of standard from our political leaders. We should not have people putting out wild theories about drugs or other solutions that aren't evidence-based.
Right. Let it be proven first. All right. So we got good. Yes, I agree with that. Now you mentioned the environment earlier. Dr.
I have to find something that you disagree with me on. I'm going to have to say something very controversial.
Well, I mean, I don't mind. Look, here's the all right. Well, okay. So we'll disagree a little. I don't mind, say, the president saying, "Here's this thing that could be working." Right. I mean, I don't mind. Here's some things on the horizon that might be working. I mean, not that it's going to work or something like that. And yes, it needs to be evidence based. So I don't mind just, try stuff. I don't mind saying that, as long as it's certainly not going to be harmful to the patient. If it doesn't help, then fine. But I think we should. I don't think there's a problem there with saying, here's something on the horizon that could work. Anyways, you mentioned the environment earlier, and the environment has been one of the silver linings of this pandemic. Is that we've seen pollution thin out. We're seeing animals returning to certain places, and that's certainly encouraging. So I guess how do we maybe maintain some of those gains that we've made with the environmentally as we start to reopen our industrial economy back up?
Yeah, thank you. I've been doing a lot of work on the climate emergency as a scientist and physician, and basically what I've concluded is that the situation is so out of control. We've already crossed many of the planetary tipping points, and we're in what I would call a climate emergency. And I think as humans living on the planet at this time, look, I'm a registered independent, I'm nonpartisan. I work with Democrats and Republicans, and I believe we need a cross-partisan movement to get on top of the climate emergency. I think that the kind of disruption that we're seeing now with COVID-19 has been immense, but it's minor compared to the kind of disruptions that we're going to see from the climate emergency. When sea level rise, massive storms. I mean, many people in Florida, Democrat and Republican, all the surveys show everyone understands that the humans have contributed to a dramatically worsening climate situation. People in California that got burned out of their house, Australia fires, I mean, the destruction of the coral reefs, I mean, on and on. The most thing that I'm concerned about is the Arctic Circle, which all the old ice is now gone. There is a risk of methane that is frozen underneath the Siberian permafrost, that if that got released, it could be a human level extinction event. So
I don't want that.
I think it's like, okay, so that's a possibility. Then we as humans, both Democrats and Republicans, should take action to ensure the survival and flourishing of humanity.
Yeah.
I have not met one Democrat or one Republican that disagrees with that idea, or an independent or non-voting Americans. Everyone agrees that we should strive towards ensuring the survival and flourishing of humanity for ourselves and for future generations. So again, I would say COVID-19 is a wake-up call for investing in a transformational approach to energy and sustainability, and instead of thinking we can just take everything and consume, we have to live in a more balance with our environment and with our use of commodities. And we can do this. I know. I've been all over the world, and there are great examples here in Florida. I mean, Orlando is doing amazing transformation, for example. Miami is doing amazing stuff. There's really great stuff happening in Florida. I mean, California, all over the country, innovation. Texas, there's some cities that are doing great, sustainable, circular economy kind of thing. So it's just a matter of the right leadership, bringing that to scale as quickly as possible. Because I'm going to be a grandfather in a couple months, or no, in a month. And I think about that baby being born and the trajectory of this century that they will live through. It's scary to me. And I feel like I have to do everything I can to ensure the survival and flourishing of humanity. And I invite everyone to really explore this. It's non-partisan. This is not a partisan issue.
Yeah, as much as I'd like to disagree, I am a big fan of the earth and humanity, and I want both to continue.
Earth will be fine. That's what we've learned. Like COVID comes, we stop doing what we did, and the sky's clear, and the dolphins come back to the Venice channels, and animals are reappearing. So Earth will restore itself once we're gone pretty quickly.
All right, Dr. Zeitz, before I let you go, I want you to give one piece of advice, a single piece of advice you can give everybody watching right now to protect themselves and move on past this pandemic. What do you got for us?
I think COVID-19 is offering an opportunity for social solidarity. We can be in community with our family, with our neighbors, with strangers, and work together to save as many lives as possible.
Excellent. Great advice. And get in touch with your community. Use that opportunity. Absolutely great. Dr. Zeitz, I want to thank you so much again for coming out and answering these questions. It was a real treat. Maybe we can do it again sometime. For those who aren't familiar with you, how can people get in touch with you and follow the things that you do? Great.
Thank you, Dave, for the opportunity. I really enjoyed it. And we got to laugh through it as well. So that was awesome.
Yeah.
My website is Dr. Paul Zeitz, DrPaulZeitz.org. Or I'm involved with Build a Movement 2020, which is a cross-partisan mobilization to solve the existential threats facing us. And that website is www.bam2020.world.
Excellent. For Dr. Zeitz, I'm Dave Oakenquist saying have a great day, and we'll catch you next time.
Thank you so much.